Good morning and welcome, everyone. I'm Yvonne Garcia, Chair of the Chamber's Women's Network Advisory Board and Chief of Staff to the CEO and Head of Global Communications at State Street. Thank you all for joining today. But before we get started, I first want to take a moment to speak about the tragic events in Atlanta on Tuesday and the loss of 6 Asian American women. To the AAPI community, we at the Chamber and Women's Network stand with you and mourn with you. Anti-Asian violence and racism is completely unacceptable and must end. Our work as allies, colleagues, and neighbors to support the Asian American community will not stop until everyone is able to work and live in peace. It remains incredibly important today and always for the Women's Network to support and connect women across the greater business community here in Boston. So along those lines, I'd like to now take a moment and help virtually welcome all of our attendees today. I hope you'll take a moment to say hello in the chat and share whether this is your first Women's Network event or your 100th. I also encourage you to all join in today's conversation and discussion on social media using hashtag BostBusinessWomen and the @BostonChamber. Please enter your questions for our guest speaker in the Q&A feature of your screen. And lastly, this program is being recorded and will be posted on our YouTube page next week in case you'd like to play it again or share it with a colleague. You know, over the past few months, I think we have all realized just how powerful our biotech community is and the strength of the talented workforce we have here in Boston. Today's featured speaker comes from a company who has been at the forefront of the work in advancing new healthcare solutions through collaboration. I am honored to welcome today's guest speaker, Michal Preminger, Head of Johnson & Johnson Innovation, East North America. Michal will discuss her leadership path and style, how she has developed and motivated her team in making a lasting impact on the innovation community, and the importance of academic, entrepreneurial, and industry collaboration in the Boston ecosystem. With that, I'd like to give a huge thank you to our Women's Network sponsor, MFS. Their support and partnership allows us to bring you all of this content today. Now I'd like to welcome Janine Comstock, Chief Security Officer for MFS, to introduce today's featured speakers. Thank you.
Thank you, Yvonne. I'm very excited to be here today. On behalf of MFS, it's my pleasure to introduce today's featured speaker, Michal Preminger, and our moderator, Rosemarie Day. Michal is the head of Johnson & Johnson Innovation, East North America, where she leads her team in the mission to positively impact human health through innovation. Michal has been a staple in the life sciences field here in Boston for many years. Prior to joining J&J Innovation, Michal was the executive director of Harvard University's Office of Technology Development at Harvard Medical School. She is a trailblazer in business and technology development, working alongside and supporting entrepreneurs, providing them with resources, networks, and the exchange of ideas to help them create healthcare solutions. Through her passion for connecting science to purpose, Michal has demonstrated an incredible commitment to the industry as well as the local community and has helped so many innovators achieve their dreams. Michal, we are so thrilled to have you join us today.
Thank you so much. I really appreciate the opportunity, and I'm delighted to be joined by Rosemarie for this conversation. Thank you, and thanks everyone for joining.
And moderating today's discussion is Rosemarie Day, CEO of Day Health Strategies. Rosemarie has years of experience in the healthcare industry as a pioneer and advocate for health reform. She has a deep passion for transforming organizations by connecting strategy to execution. As a founding leader of the Health Connector in Massachusetts, she had a significant impact in establishing the first state-run health insurance exchange in the U.S. In Rosemarie's current role, she is focused on implementing national health reform and working with organizations who want to transform their approach to offering health care. Most recently, Rosemarie is empowering and encouraging women to lead the fight for universal health care in her book, Marching Towards Coverage: How Women Can Lead the Fight for Universal Health Care. Rosemarie, we thank you for being here today as well. And with that, I will turn it over to you.
Wonderful. Thank you, Janine. And it's wonderful to see all of, well, can't exactly see all of you, but in spirit, we are here collectively. And I love the theme that we all belong, and the empowerment thread of this network. And so I'm delighted to be able to have this conversation today with you, Michal, as a leader in healthcare innovation, and also, frankly, as somebody who has such an international perspective. And I look forward to being able to talk to you both about your personal journey as well as what you're doing with Johnson & Johnson Innovation. I think, as we all know, or many of us know, Johnson & Johnson Innovation's mission is to positively impact human health through innovation, and to help entrepreneurs realize their dream of creating healthcare solutions to improve people's lives all over the world. So in 2013, you opened the Innovation Center here in Boston. But before we talk about that, I actually want to understand, because you were in Boston prior to that, in a different role, and having been really all over the world and studied in Israel and France, can you just share a little bit about why Boston? What brought you here originally, and what is keeping you here?
Yeah, thank you, Rosemarie. Thanks for being my partner for this conversation. And I wish we could have more time to cover many topics, but certainly my arrival in Boston marked a very important inflection point in my career. So I almost divide my career into the exploratory phase that preceded my arrival in Boston. So as you mentioned, I started my journey in Israel, by the way, a place where universal healthcare is implemented. And so, at some point, maybe we'll talk about that. So my career started, my journey started with medicine and science. And then in an attempt to understand where my place in the world was, I got an MBA and did a detour in the tech industry to acquire more business skills, and then went back to biotech to follow the passion for that, and participated in a company that started started its journey with genomics, and had the chance to take that company public as part of the management team, and then start my own company. That was the point in which I was invited to come to Boston. So at the time, Harvard was looking to refresh and reinvent its approach to innovation and to translation. And I felt that my dream job was just presented to me. And the reason for that is that through that exploratory journey, I learned that there were a few things that were very fundamental for me as a person, and definitely in my professional career. And so the first is really deep love of science, just fascination with what science unveils for us every day, and doing it more and more expeditiously as time goes by. And the second is a true passion for making a difference, and I chose to make that difference in the field of human health. But I do appreciate that people may find different fields and ways to make such impact. For me, it became healthcare, and later also diversity, equity, and inclusion. We can talk about that a little bit later. And then in terms of environment, I realized that I was not a one-track person. I needed a big platform with many balls always in the air. Otherwise, I feel like I stagnate, and God forbid, don't push myself enough. And so that's really important. And finally, through that journey, I realized that the unique place in which I can make a contribution is really that interface between science and business, translating in both directions, bringing the understanding of the business and product and commercial world into earlier stage research and innovation, and then translating from the other side, looking at raw science or sometimes raw technology and saying, oh, this could be one day that product that will save lives, and how putting it on track and designing that path and starting to mobilize. So Harvard, the Harvard job actually checked every single box on my list. And in addition to that, it was in Boston, really a mecca of biotech and healthcare, with its cluster of academic institutions and an emerging ecosystem. And this was back in 2005. And when I arrived here, I thought to myself, well, I'm the last one to this party, right? I mean, everything has already been invented here. Everyone has their place, and I'm coming as a complete stranger and outsider to this a wonderful ecosystem. But I have to say that thanks to the generosity of this community, I found my place here and got to play a role. And in many ways, this was really the beginning of the amazing explosion of development and growth here in the Boston area. And so in some ways, I got to kind of be one of the founding mothers of this ecosystem, which is a privilege that I could never imagine at the time that I would have. And maybe before I turn it back to you, I'll just say that out of that, there were a few things that I wanted to note. And you started by mentioning J&J. So actually, at 2013, when I was already kind of an established entity in the ecosystem, I really admired the fact that J&J came in and placed an innovation center, and in many ways was the pioneer of the flow that has been going on since, of major pharmaceutical and tech companies into the area, and particularly Kendall Square. So I really appreciated that at the time it wasn't the most popular thing to do necessarily, and that was part of maybe what translated later to the choice to join J&J. Another thing that I would say, just to people listening in the audience, and I'm sure there are women here and maybe also men who are listening who think that they are, they are late to some parties. So I will say, first, I think that we are just at the beginning of an era that would be even more explosive and amazing, where science is, where our ecosystem is. This is the best time to enter into this ecosystem. And maybe on another note, I mentioned being a mother. So I'll just say that as a mother, coming to Boston was a very ambivalent event for me, because I had to relocate my family again after doing it just a few years earlier. And there was this dilemma of whether, separating my partner and my kids from the extended family in Israel was the right thing to do. Was I exacting too much of a high price from them? And I have to say, after being here for kind of close to 2 decades now, I see my family thriving so much here. My partner is part of that ecosystem. My kids have contracted the science virus and the love for healthcare, and each one of them found a way to define a journey for themselves that has to do with it, but in different ways. So my son now works in a biotech startup in Kendall Square, and my daughter is pursuing public health. And so it has been a rewarding experience. And I just wanted to mention this because it wasn't obvious to me at the time as a mother that moving to Boston would be a good thing, but all ended well. So.
Wow. Well, you have covered, you talk about having so many kind of, I think of like spinning plates or having a large platform, and it sounds like you're the mother of many things. You're going to have you're having a ripple effect and legacy here through your professional and your personal life. And really, you should be I think the poster child for recruitment to Boston, given that you've just described the richness of this environment across so many dimensions. So I hope the Chamber's making a note of that. But let's come back to, you said you were that taking that Harvard job was your dream job. It checked so many boxes. And yet you made the move from Harvard Square to Kendall Square. So maybe you just wanted a new venue geographically, but I think, of course, it was more than that. So say a little more about this Johnson & Johnson Innovation Center and what attracted you to this opportunity.
So, so Johnson & Johnson is an innovation-based company. It has relied over the years on both internal and external innovation to push the boundaries and to continue to serve consumers and patients across its multiple sectors, pharmaceuticals, med devices, and consumer health. And so it's always been about partnerships with the external ecosystem. But around 2013, a strategic decision was made to actually immerse and participate in early innovation ecosystems as a strategy to fuel innovation, and to do it in a way that is not just, we talk about accessing innovation or harvesting innovation, words that I'm totally allergic to, coming from the side, or a career of knocking on big companies' doors and not always find them open. So the idea was to come and be where innovators are, and to make an investment early and try to meet entrepreneurs along their journey where they are, and offer the opportunity to benefit from large company expertise and infrastructure to accelerate these early innovations, and with the ultimate goal that some of them that are a good fit and where the relationship works really well will onboard into J&J and use the J&J big platform and capabilities to bring products to the market and to patients. So that was the premise, and Kendall Square was chosen as one of 4 hubs around the world to do that. And I would say, of course, I already mentioned the tremendous ecosystem that exists here with academia, with a company forming venture capitals, groups, and accelerators and incubators, and so on and so forth, some of which actually didn't exist. So J&J was a founding partner of Lab Central, which many of you know as a very important junction of innovation. But the decision was made to do that, and beyond the infrastructure that is here, I think that the very unique spirit of collaboration in this ecosystem, which made it so successful, it was one of the draws. And since then, we expanded our J&J innovation presence here. So we have multiple locations for J Labs. Lab Central is one of them. M2D2 in UMass in Lowell is another J Labs location, and we have a little J Pod, what we call a J Pod for health tech and other types of innovations that don't require lab space at the Cambridge Innovation Center as well. But we also expanded our footprint in terms of R&D through both organic growth and acquisitions. So most recently, we acquired Momenta Pharmaceuticals, and prior to that, Terry's. And we also grew organically our presence with digital robotics right downtown Boston, and with a cardiovascular metabolic group in Longwood that is focused on kidney disease. And then we traditionally have had a very strong presence in Raynham with our medical device group. But I will also mention, because we're thinking about the future of healthcare as being very patient-centric. So I know that many companies talk about being focused on the patient, but we usually do it through the peephole of what we can offer, right? So sometimes it's drugs, and sometimes it's medical devices, and sometimes it's a digital therapeutic. So for J&J being such a diverse and large healthcare company, we believe that we can be the convener of a future in which patients really are offered everything that is needed to not only treat the diseases, but actually early detect them, intercept, and sometimes prevent or sometimes cure them as we are able to tackle them earlier. And so one of those initiatives is actually run out of here, out of Boston, in another collaboration with a local university, that's BU. And so the lung cancer initiative is run from here, mapping the journey from health to the stage in which currently, usually later stage, a diagnosis that is happening today, and looking to prevent through innovative approaches to smoking cessation or prevention, for example, using our consumer health approach, a medical device approach for early detection that involves what is, the equivalent of colonoscopy with bronchoscopy, allowing us to actually detect and also ablate early nodules in the lungs. And finally, also earlier intervention in terms of pharmaceuticals. So all of this is happening right here in Boston, and we're very excited about this. And maybe the last point that I will make is that one of the things that really makes all of this special are the multiple collaborations that are happening here. So it's not just us sitting here, but we become part of a very convoluted network that is all focused on changing the trajectory of human health.
Absolutely. And I think that we're seeing the fruits of a lot of collaboration, just even in the pursuit of the coronavirus vaccine, and in all of its forms. The fact that you sit in a perch that you are kind of the consummate intersectional person, that you did spend time in academia and now you're back onto the business side here. But speak a bit more. You've referenced several collaborations that are bridging with academia. What's your favorite one of those? And then I do have to throw in, folks have probably heard about the collaboration with Merck, not an academic institution, but actually competitor, I think, potentially. And I don't know if you can comment on that, but it's certainly, it seems that this time of the pandemic has, I guess because of the emergency nature of it, we are seeing new forms of collaboration. And so if you could even comment on that, that would be helpful.
Sure. No, thank you. So maybe I'll start with some of our academic collaborations, and I will not start with the science. I will start with a field that is very, very dear to my heart and all of our hearts here today, which is diversity, equity, and inclusion. So I will start by saying we have multiple collaborations with local academic institutions, as well as other entities around diversity and definitely in science. So one of those programs is the Wisdom 2D program, focused on young female scientists, and expanded also to racial diversity. And we have this program partnered with multiple institutions in the area. I already mentioned our JLabs collaboration with UMass Lowell at M2D2, supporting spin out from the university, but also from other sources. And I also mentioned the lung cancer initiative with Boston University. I will also say that we have a multitude of scientific collaborations with the academic medical centers and universities in the area, as well as many touch points. So I mentioned earlier that our strategy or our approach is to be helpful to entrepreneurs and develop relationships that are creating value for them, whether we have a formal collaboration or not. So our team here is very, very closely connected with many of the academic institutions, sitting on the advisory board for the accelerators and incubators, judging pitching competitions, doing mentoring one-on-one with many of the scientific founders who are looking to find their ways. And this is definitely an area that is particularly dear to my heart, because having lived the reality of how complicated it is to navigate, keeping a lab and also spinning out a company or involved in industry, this is not trivial, but very, very enriching and rewarding for those who participate. So we are all busy doing that. I think that one of the things that is special about this ecosystem is the circulation of people between academia and industry, small company, large company, VC, back to academia, and so on. And I think it's the magic power of the Boston ecosystem in many ways. So I'll just to cover the other part of your question about COVID and what it has triggered. I think COVID did amazing things, and I will start actually not so much with the collaborations, but actually with the observation that COVID has really expanded the circle of innovation and innovators in a very unique way. So we see complete a kind of populations who were not involved before coming into this. And we recognize the convening power of J&J. I mean, we were not responsible for all of this, of course, but for example, we launched campaigns to work with nurses to bring their innovation related to COVID and later to mental health and help them translate it. And we did this at the global level. Similarly, we invited and convened diverse talent to come up with solutions. We have partnered with BARDA to create a Blue Night program for pandemic preparedness that invites innovators from around the world in collaboration with our JLabs to pursue technologies that are related to pandemic preparedness and biodefense. And finally, I will maybe quickly describe an example that just yesterday was recognized by Gartner as Innovation of the Year. And it wasn't really our innovation, but we enabled it. So recognizing that as a large company, we may have resources that can enable COVID-related innovation to be accelerated. We identified 3D printing as a core capability that could expedite the manufacturing of certain things that are needed. And I'm sure everyone remembers that when COVID just started, there was great shortage of ventilators, which seemed to be the bottleneck at the time. And so we had this idea that 3D printing could be used to produce ventilators or ventilator parts. And we reached out to a large number of companies that tried to develop solutions for this. And the innovation that was recognized by Gartner was a partnership with Prism Health that actually designed a ventilator splitter that allowed and it was approved by FDA for emergency use. But Prism had the design, but they didn't have a way to manufacture. So this was meant to allow 2 patients to benefit from 1 ventilator, and so double the number of available solutions for patients. So our 3D printing team has commissioned J&J Innovation to do the outreach. We identified that, and within 7 days, we actually moved from the blueprint to delivering thousands of those ventilators. It's called Vesper, And it was really about the process, mobilizing all of the resources, getting all the approvals. Everyone was working around the clock, and this is the type of collaboration and sense of urgency that I hope all of us will preserve and retain from this pandemic, because we prove to ourselves that we can do things on a very amazing time frame, and that by all working together and collapsing barriers, we can achieve unbelievable things. So very inspiring to me, and I think we all have our examples from this era, and we'll continue to learn from this.
Let's pick up on that, because you talk about your passion for diversity, equity, and inclusion. And I want to tie that back to COVID, because COVID has laid bare the health disparities in this country that are pretty profound for such a wealthy country. So many people are left behind, and it's something that you can't unsee, frankly, after going through this past year. Many public health experts, of course, were already aware of it, but now I think there's much more awareness in the general population. How can we take, lessons learned and innovation and this kind of amazing collaboration and great things that have happened, and apply that to what have been long-term systemic problems in this country? And so your commitment to DE&I, your international perspective, all of that, I'd love to have you bring that to bear as you respond to this question.
Thank you, Rosemarie, for bringing this up, because I am indeed passionate about this. And I mentioned earlier, I come from Israel, where healthcare is obvious. So, universal healthcare, not coming out of anybody's pocket. Maybe it's not 100% of the time, 100% of the cutting edge, but it is very good, and really doesn't leave anyone behind. So that's how I grew up. By the way, it was also connected healthcare. So when I was growing up, there was already, electronic medical records, everything was connected wherever you went, all these dreams that we're dreaming today here were actually in place at the time. So definitely coming to the US has been a learning process, and somewhat of a shocking learning process to realize how many challenges and opportunities there are to do better here. But I will start by saying that I am actually very impressed by the response of the entire ecosystem here and industry in general to this realization of what is happening in terms of healthcare disparity and racial injustice in the last year. And I see so many leaders with very strong conviction to become accountable and to do rather than talk about the problem. I think it's not a new problem, but I see a very different approach. J&J has diversity, equity, and inclusion, and also the care for global communities and creating access to medicine in its DNA, in its cradle, which is more than 75 years old. And one of the things that impressed me about J&J and helped me actually make the decision to join J&J was this commitment to the cradle. So many of the things that I will describe have not been triggered by the pandemic or by the events around George Floyd's murder. They were there before. So accountability in terms of diversity. We measure ourselves as leaders on the diversity of our teams. At J&J Innovation, we measure ourselves on the diversity of the companies we partner with. In J-Labs, we monitor female leaders, we monitor minority leaders, and we make a sincere efforts to enrich that. And I mentioned earlier our convening power. So we use multiple quickfire challenges. Those are open innovation calls to solicit and to inspire innovation that would come from diverse diverse populations, and also growingly target areas of need. The most recent commitment from J&J to this topic is our $100 million Race to Health Equity initiative that was announced recently, and that includes elements that relate to inclusion of diversity, both gender and racial, in the workforce, healthier communities, collaborations with local communities and entities to tackle these issues. We pay very, very serious attention to inclusion in clinical trials, and are forging many collaborations in the communities as part of that initiative. But I will just again stress that this has not started today, but definitely we are doubling down very, very aggressively on this. And as a leader, this really impresses me. Maybe I'll sneak in a note about why J&J, because you talked about, I had the dream job at Harvard, so why J&J? I would say that J&J definitely deserves to be joined. However, for me, I was not recruited by J&J. I made a very conscious decision that I can't, as a person who is involved in innovation, I have to push myself as well out of my comfort zone and out of my dream job to find the next one and make it the dream job. And the time of that, I want to stress how important motherhood is to me. And so the timing of my future departure from Harvard was not related to my job at Harvard. It was actually related to my kids' journey. And so I made a decision that in 2018, no matter what the situation is at Harvard, that's the time when my daughter left home to do her gap year, city year, I will make a change. And I first decided to make a change, and then I looked around and decided where I'm going to go. And again, J&J, with its power and commitment to impact, and its credo, as well as its forward-looking thinking about patient-centric approaches, seemed like the company that will allow me to be part of leading the healthcare revolution that we all need, and that I hope will happen in the coming decades. So that was kind of the background for that.
Thank you for coming back to that. I love how you're weaving in again. Sometimes I think we're asked to compartmentalize our lives to the professional and the personal. I love that you're talking about this from a more integrated perspective. And that's actually another thing that coronavirus has kind of, I think, forced upon our society more generally, that we cannot be totally compartmentalized. So I appreciate you bringing that in. And, I'm going to ask one more question related to that, and then we're going to open it up to the audience. But this passion for diversity, equity, and inclusion, does it come from a personal experience you've had? Does it come from something from your mothering? I just want to, because, people could look at you and say, well, you're relatively privileged, you're all set. What is it that makes that part of your decision criteria as to where you're going to go? And I'm going to throw in one more comment. You talk about moving out of your comfort zone. And I went to a conference, and one of my favorite closing quotes was that life begins at the end of your comfort zone.
Mm-hmm, that's very true. It's very true.
Yeah.
So I'll let me speak for a second about diversity and inclusion. So I grew up gender oblivious. So I never thought of myself until actually I came to the US. I never spent even 2 minutes thinking of myself as a woman, counting how many men, how many women. I never did that. And I had this, when I came here and I started, and I was more exposed to questions of diversity, equity, and inclusion, I asked myself whether whether my methodology kind of oblivion was not a good idea to share with others and say, just ignore it and it will be fine. And it took me a few good years to actually acknowledge that this would not work for everyone, because not everyone comes from this place, and people have very different experiences. And so I learned to appreciate how important it actually was to acknowledge and to provide the support and the tools for women or minorities to deal with things that they actually don't ignore. I mean, not everyone is built the same way, and it created a very, very strong commitment for me. The other thing that I will say is that my daughter taught me so much about, both my kids taught me so much about diversity. My daughter was focused for a while on gender diversity, and her experience growing up was very different than mine in some ways, the opposite of what you would expect. That, you know, I felt that I was growing up in an equal environment, and she was very sensitive to inequality. And my son taught me a lot about racial diversity, and I learned from them still today, and also from the experiences of people we work with. But it definitely has been an acquired passion, not one that came from my own experience. I have always felt very strongly supported, even as a young mom. You know, I remember resigning, you know, when my son turned 9 months old, I decided to resign from my job. I said, I can't be a mother and also do this job. I was working for a tech company in Tel Aviv, and it was, you know, I always had to work long hours to meet the US time zone. And so I remember submitting this letter, and my boss took it and tore it apart, and he said, "What's your problem?" And I said, I can't do it. And he said, "Okay, I will tell you what's going to happen. What is going to happen is that at 3:30 every day, you're going to leave here. And if I ever catch you at 3:31, I'm going to fire you." And I said, "But how am I going to do my job?" And he said, "You're going to do it with one hand tied behind your back. That's how you're going to do it. You're going to do it fine." And I am so grateful for that person, for just showing the confidence that I could do both, that somehow things will get done. And I think you know, probably it turned out to be a good lesson for me, and a good outcome. But I again, talking to the audience, I mean, I think many of you have the ability to actually influence other people's lives, and connect with the concerns and the ambivalence that comes with challenges that we all face in our work life integrity, in our new integrated work lives. And so I just feel that every one of us can make a huge difference for others, whether it's peers or friends or people who report to you, or even your bosses sometimes. As a leader, I would say the life of a leader is not always easy, and sometimes even getting that support from the people who report to you is really important. So yeah.
Thank you. You know, I think I think that we appreciate your candor, and I like the fact that you said it was an acquired passion. I think because that opens the door for folks who are thinking about some of these issues maybe for the first time, and then feel apologetic and aren't sure what does it mean to be an ally, and things of that nature. I think that's a really inclusive perspective, that, you know, you can come, to go back to something you said earlier, late to the party. This would be a different party, but you know that it's not too late. And so I like that message. I want to open it to these great questions that are coming in, and this one probably relates to some of what we've just been talking about. With such a great pool of and a pipeline of talent for tech and healthcare industries in Boston, how is Johnson & Johnson Innovation partnering with academia to keep that talent in the area for our local workforce?
Yeah. So that's a wonderful opportunity to talk a little bit about purpose. I feel that what I talked about, the spirit of collaboration, is one of the areas that are unique to this community, and I think the other one is is really the special spirit of people who come here, many of whom are inspired by what has been created here and looking to make a mark in the world. And I think that there is an opportunity for, so I think in general, what has been created here is definitely a magnet for talent, not only to come to the universities, but also to stay here, looking at what is happening in terms of entrepreneurship and just opportunities for personal development and growth. But beyond that, I think that the fact that we lead in areas that are important, and healthcare is one of them, it's not the only one. I believe that for the current generation, this is extremely meaningful. We are looking, at least I'm looking at recent college grads, and they are more interested in sustainability. They're more interested in justice, and they're more interested in impact than the previous generations. They don't need a car, they don't need, and maybe I should say you don't, because maybe some of you are here today who don't need a car and don't need a big house, but have a very, very clear priorities in terms of what your life journey needs to look like, and making an impact is one of them. So creating the opportunity to go beyond just a job and make it meaningful is definitely important. And I have ideas for how we can actually integrate our ecosystem better, especially in the area of data science, where we may be bleeding more of tech, where we're bleeding more to the West Coast than in biotech. Just creating an integrated approach that would give people the opportunity to work with the best data and make more impact. But I don't know that we have time to go into all of those details. But if you're interested, then contact me, because I'm very passionate about it and would love to see this happen in coming years.
Yeah, I know we could talk for hours and that would be really fun. I am struck by something that we have in common. You mentioned Tel Aviv. I grew up in San Diego, and here we are, and those are identical climates, having visited Tel Aviv. And yet here we are in Boston, where, let's just say it's weather-wise, not quite an ideal climate. Depends on where you're coming from, but and when my kids ask, who are now adults, why on earth are we in Boston when we could have been in California? And I said, well, it's not just about the weather climate, it's other kinds of climate, which I think now they're just starting to understand as you talk about ecosystems and, being a magnet for innovation and impact, that people want to make a difference in meaningful ways, not just how much money can I make. I agree. I think Boston is very much a hub for that. So let's talk about another question here, is that somebody's noting that because of the pandemic shutdown and incubator and lab spaces really being pretty profoundly affected by that, did you see a shift in your entrepreneurial partners? And what did it take to be able to keep some of the projects going that had at least initially relied on that kind of in-person space?
So the response of our ecosystem to the crisis in terms of enabling a return to the labs has been incredible. But there are a few things actually to mention in this context. So first, I mentioned earlier that I felt that the pandemic has attracted a new entrepreneurs into our circle of innovation, I like to call that. So some of those were academic researchers who, out of the desire to respond to the pandemic, as well as the desire to keep their labs open very practically, found themselves working on highly translational projects related to COVID, where in the past they would do basic research. So suddenly we have a whole new cadre of entrepreneurs by night, who are joining the circle, and so the ingenuity in terms of shifting and diverting efforts has been incredible in academia. In the biotech space with young companies, yes, we have seen some delays, but the response of the ecosystem is incredible. The Broad Institute, CIC, Cambridge Innovation Center, which really you could claim, like, what business do they have in testing and then later in distributing the vaccine? The response was just incredible, and I think reality has shown that we came back to the labs very quickly, probably more quickly than anyone anticipated, and more quickly definitely than other parts of the country, thanks to that recruitment of the talent and infrastructure that we have here. And I think we inspired many other places around the world, and the fact that Eric Lander is now in Washington is probably a testimonial to this, and Rochelle Walensky. So I would say that we have deployed, and we immediately created a task force within J&J Innovation to support the companies that are struggling. We brought our supply chain, our different regulatory resources to help companies that were stuck because clinical trial was put on hold, and we thought that we could bring some of this expertise to help find alternative sources of supplies, or navigate how to handle a situation. And to our amazement, I don't want to say disappointment because because it was a good thing. We realized that there was so much happening in the ecosystem that our contribution was important, but it was not the only one. And so again, kudos to this ecosystem for just coming together and prioritizing going back to the labs. We still actually work from home in order to respect the need for lab workers to be in the labs, and in wanting to minimize the presence of people who can do the work from home, and so that is part of that small contribution to return to the labs. I hope that answers the question, whoever asked it.
Thank you. So here's a small question. What do you see as the next trend in life science innovation?
So I have to say that in terms of what science brings us, there is just an explosion of opportunity in every field of science and technology. I think that maybe from the need side, I would define holistic solutions for patients. They need to shift from treatment to prevention and early intervention as some of the important things that need to happen and are starting to happen. So when we think about the current landscape, there is this explosion of new tools coming from science. I just mentioned CRISPR. I'll mention soft robotics. I mean, there's just so many things that are coming together, and digital capabilities and data are coming together. 5G is on the way to enable us to do real-time things in a way that is unprecedented. There is so much pressure on the healthcare system to change the model, and to because current costs are unsustainable, and the system is not working. And there is a lot of new ownership by people of their health and well-being that is pushing for more patient-centric, holistic solutions. So I think that is the future, and I think that there are multiple forces that are engulfing that challenge from different directions. I will also add, we talked already about healthcare disparity. I think that without addressing this, we're not going to be able to move forward. It's not just morally unjust, it's also not sustainable. So I think the two will go hand in hand, and we need to pay attention to all parts of our community to bring us all together. And this is not just true for the US, it's true globally. We can't, I think the pandemic has taught us that we're all in, we're all in it in this one globe, and need to pay attention to this as well. So these are kind of the big picture ideas.
Thank you. You have consistent themes running through all your responses, so that's wonderful. I'm going to ask one last question because I think we're getting to our wrap-up time, and unfortunately we don't have a lot of time for it. But you've certainly indicated a lot of things that have helped you as a leader as you stretch yourself to grow and do an ever more diverse and complicated set of things. Is there one piece of advice you would give to our audience that has really stood you in good stead in terms of your leadership journey and what people should think about?
I would say that what has guided me at the personal level is this idea that if I conduct myself with generosity and humility, it will serve me well. It's counterintuitive. I mean, many people say, you need to stand up for yourself. I feel that actually this has been the way for me to keep learning and growing through humility, share credit, to bring people inclusively into the same circle, and inspire in a way that is very gentle and humble. And the generosity part, I think, has I learned from others who have treated me with generosity. I mentioned my first boss. I mentioned this ecosystem, and so really seeing people and where they are and what they struggle with, and putting yourself in their shoes has been maybe a sacred principle for me. And we talked about entrepreneurs, we talked about scientific founders and the journeys. It is so hard. It's just so hard to try and drive a new scientific or business concept and persevere through the failures of early innovation. It's just something that is so difficult to do, that empathy, generosity, and humility, these are the ways in which I believe you can support others and make them follow a vision that you have, but really get everyone to buy into for the right reasons.
Wow, that's wonderful. Thank you. That's I think a great note for us to wrap up on and for people to sit with.
Thank you, Rosemarie. Thank you so much. I appreciate you guiding this conversation in such an interesting and engaging way. Thank you so much.
Thanks.
Thank you very much. I agree, Rosemarie. What a great moderator, and Michal, your insights are just so amazing. I jotted down so many notes. I love just the impact that you've had on the innovation community. Your integrated perspective is so important, and you're absolutely right how critical it's been during the pandemic. I also love the story about bringing your family here and the sacrifices that you made and how it turned out to be such a blessing for your family. It sounds like your children are doing well, you have a great career, and at times as women, we fear making those moves. And it's just turned out great. And as a result, it looks like your children are living a much richer, fuller life because of the risk that you took, right, as we classify them at times. and the collaboration and the behaviors that we've seen during the pandemic, being able to bottle those up, that sense of urgency and that collaboration are key. I also love your gender oblivious. I just love that mindset, because why would there be a difference, right, in your mindset? And then coming here and then also understanding that there was some things to learn, that acquired, perspective that you have. So it just really, I can go on and on. I have like 5 pages of notes, but I am respectful that we're coming up. So I wanted to thank both of you. What a rich conversation you had. Thank you very much. The Chamber also has a packed calendar of digital events coming in the weeks, including a special event with Tim Ryan. He's the U.S. Chairman and Senior Partner at PwC, and that's next week on the 24th. And of course, you can learn more about other events by visiting bostonchamber.com. So once again, a huge thank you to Michal, Rosemarie, our event sponsor, MFS, and our media sponsor, GBH. And with that, I hope to see you all again in April. Have a great day and happy International Women's Month.
Thank you. Thanks everyone for joining too.
Thank you.